Yes, it is, and we have contributed, of course, to the national numbers, but this is something I presented a little bit of it, but not all of those details. But yes, the people who are ending up in hospitals, so we know that about 47% of our overall cases are male, so the majority, 53%, are women. And that reflects, of course, that many of our cases are healthcare workers, at least early on. We also have about a third of 40% of people have an underlying illness like cardiac disease or diabetes or heart disease or, sorry, I said cardiac disease, or respiratory illness or cancer. When we look at our hospitalized patients, though, they are slightly older. They're more likely to be in their, the median age was in the 60s, and they were 2/3 of people who've been admitted to hospital are male, so that is overrepresentation of men compared to women, given our cases were less than half. And in ICU, it's about the same, somewhere towards 65–70% of admissions to ICU are in men. Older, again, slightly older, and about 2/3 of people have who are admitted to hospital or admitted to ICU have underlying illnesses like diabetes being one of them, heart disease like hypertension being quite high. I think it was about 1/3. And I can present some of this information in more detail to you. But we are seeing that same predilection for men to have a higher likelihood of being hospitalized or having or being in ICU. Our deaths, of course, are heavily skewed towards the older age group, reflecting people who may not even get into hospital or ICU because they are infected in a long-term care home and choose, or progress very rapidly in long-term care. But the whole question of why men are more likely to be to have more serious illness than women is one that is being asked around the world, and some people's theories are that our immune systems are different, men and women, and one of it is because women's immune systems adapt to be able to have children and have pregnancies without their immune system fighting them off. And men, on the other hand, are more likely to have more of the proteins, the cytokines that cause our immune system to get excited and to attack viruses that invade our system. But that's speculation. We don't know for sure, but there's quite a lot of work being done around the world to try and address this issue. It's something that it's a phenomenon we're seeing everywhere. So initially people thought it might have something to do with in Asia, in Wuhan, for example, but it's being seen in Italy, in the US, and here as well. So probably has something to do, it may have something to do with the male immune system, but there are more factors than that, including, the higher proportion of men in that age group who might have underlying illnesses like heart disease and diabetes, as well as other genetic factors that we just don't know yet. So it's one of those really interesting things that has borne out in countries around the world that we still don't have answers to yet.